Much for your time. Now, the Kenya Union of Clinical Officers, KUCO, has stamped the new Social Health Authority rollout as chaotic and reckless. Addressing the media early Friday, KUCO Secretary General George Gibore said many clinical officers are yet to be enrolled into the new system as service providers. This as Kenyans decry being forcibly transitioned into SHIF, a move that has been termed illegal by lawyers. Our Health and Science reporter, Chebet Birir, with details on this story.
Continues to drop sharp reactions from the public. The transition has not been smooth at all. Many patients continue to be turned away from some private hospitals or are forced to make payments. The latest entrant to the debate being the Kenya Union of Clinical Officers, which argues that the rollout is chaotic and being implemented recklessly. KUCO Secretary General George Gibore says many clinical officers are yet to be empaneled into the new system.
834 facilities that were already offering services under NHIF have not been moved. So that's to mean you are telling those who have been relying on those services that they are not going to get services.
According to Gibore, clinical officer interns are also facing it rough in their duty stations as they were posted without proper terms and have not received their stipend for months.
They are forced to sleep with the patient in the wards. They are forced to eat from the food of the patient.
Meanwhile, a section of Kenyans are not happy with the forceful transition from NHIF to SHA.
Nilipata ujumbe jana eti wameni-migrate kutoka kwa NHIF kwenda kwa SHA, but sikusikia vizuri.
Nimewekwa kwa SHA, na hii SHA sijajiondoa mimi mwenyewe, nimejiondolewa ati mimi sasa niko kwa SHA, na hiyo SHA sijaikubalia naye.
This as the Ministry of Health insists that the migration is lawful as per Legal Notice 147 of 2024 and that the process ensures continuity of the coverage.
It has relied on non-existent regulations to claim that there is legal backing for automatic migration of people that are from NHIF to SHA.
Personal data includes your name, phone number, your birth certificate, and your location. Sensitive data includes but is not limited to your health status, biometric data, your ethnicity, and your marital status. The Ministry of Health requires all these personal and sensitive information to be included while one registers for the social health insurance on their website. It is now 4 days into the rollout of the new Social Health Insurance Fund, and as it stands, many service providers are without formal contracts as dictated by the Social Health Authority regulations. The promised digital contract is also yet to be implemented, and this leaves patients and healthcare providers in a state of confusion. Chebet Birir, KTN News,